Oh, we're going to have all dad songs.
Yeah. Has Nelly done any dad songs? I know you love Nelly.
There you go. Nelly has a dad.
Yeah, Nelly daddy smelly. Watching the telly. Nelly.
Looking at my belly. Now, tomorrow is the start of Women's Health Week, which is a time to encourage women across Australia to make good health a priority.
Organisers surveyed over 2,800 women to find out what they knew about healthy living, and the results may surprise a few of us.
In the first women's health survey of its kind in Australia, doctors found women were more concerned about age and weight and less concerned about heart disease. Health experts are troubled by these findings, given that worldwide more women die from cardiovascular disease than all other cancers combined. The survey found most women were focused on healthy living, followed by cancers and mental health, but only 5% were worried about cardiovascular health. Cancer and high blood pressure run in Marion Wright's family. Health is a priority for her.
I've done triathlons and I've played competition tennis, and from that we found Zumba. I just enjoy feeling healthy.
The survey found most women want more health clinics and more doctors who specialise in women's health.
And joining us to talk about women's health this week is Dr. Mandy Deeks, a researcher, educator, leading expert in women's issues with Jean Hales. Good morning to you, Mandy.
Good morning.
Now, you know, the stats tell a pretty sobering story. Every 30 minutes, one woman in Australia suffers a heart attack, and, you know, 11 women die, you know, with startling frequency. Why isn't heart disease the number one priority for women's health?
I think we tend to think of heart disease as a male thing. We see pictures of men when we're talking about heart attacks. Women aren't treated in the same way. They have different symptoms of a heart attack.
Right.
So we found in the survey that 68% of women are telling us they want more information on heart disease and what it means.
Well, what are the symptoms that women have that are different to men?
Well, it's actually, so the symptoms of a heart attack can be a sort of a flu-like feeling. A lot of women feel indigestion and think they might have a bit of acid reflux. They get pains in their arm, tingling in their jaw. They may have the classic chest pain, but not as much perhaps as men do.
Interesting.
So, and women are living longer, so then heart disease tends to creep up on us.
The other thing to come out of this survey is that women said that they were far more concerned about weight and their appearance, how they looked and age, than cardiovascular disease, than even cancer, which perhaps gets more airtime. You know, how do we redress that, do you think?
That's a fabulous question, because if you think about weight, that's one of the risk factors for cardiovascular disease. So I think women are saying they want to look good and be healthy, but they haven't made that connection with protecting themselves from cardiovascular disease. So we've always, you know, got that focus on appearance, and women we know tend to feel guilty about eating and all of those messages, but let's turn it into a really strong health message.
Yeah. Look, the big message, of course, of Women's Health Week is that we need to talk more openly about these health issues, and, you know, we're letting the elephant out of the room, so to speak. One of the issues that we rarely talk about, and women in particular, I think, is painful sex.
Yes.
Just too embarrassed to broach this subject, even with doctors.
Yes.
You know, what do we do about that to overcome that embarrassment?
Well, again, a lot of doctors actually said that they want women to come and talk to them about painful sex. We know that around 20% of women will have an issue with painful sex, but they're not necessarily bringing it up. Maybe they've got a whole lot of other things going on and they are embarrassed, but we would like to encourage women to have that conversation. And doctors are saying we want women to have that conversation.
Because it can be for a range of reasons, right?
Yes, it can be. It could be from childbirth. It could be from menopausal symptoms. There's a whole bunch of reasons. So and it's nice for women to know that other women are experiencing it, that they're not alone, and that's again why we want, you know, let's get the elephant out of the room.
Totally.
Start talking.
Yes.
Now, the other focus is domestic violence, which certainly has been more in the public eye for the last year. You know, is there any way of potentially identifying women, or the women identifying themselves, that they could be in a potentially violent relationship before it turns violent?
It's tricky because in those first few months when you might be really attracted to someone, you tend to dismiss some of the warning signs. But there are some, and it's about perhaps being a bit frightened to bring a topic up. That sense of feeling controlled in some way. So, maybe money's being controlled, or where you go and who you see, who you talk to. And if you start to get that sort of niggling feeling that things aren't quite right, it's really important to start listening to those.
And I think one of the big things to emphasise here as well for Women's Health Week is that the health impacts of those non-physical forms of violence, that sort of psychological, emotional violence, can be just as damaging as physical violence. And the scars from that kind of behaviour can last a long, long time. And also the effect it can have on your kids as well, witnessing violence.
All the way down the line.
Yeah.
Anxiety is one of the big symptoms of domestic violence. Domestic violence is probably one of the most important things that influences mental health.
Yeah.
And so we really do need to start listening to that. Emotional abuse perhaps is not out there as much.
Yeah,
and,
indeed.
if someone's controlling how you're thinking and feeling.
Totally. So, Mandy, look, you're covering all sorts of issues here. You've got the cardiovascular stuff, you've got the sexual health stuff, you've got DV, you've got alternative therapies, all sorts of issues being canvassed during Women's Health Week. And the website is www.womenshealthweek.com, right?
.au.
And we'll put all of the
Terrific.
details on our website. So if you didn't get that down, you can just go to our website. Thank you, Dr.
Thank
Mandy
you so
Deeks.
much
Lovely
for
to
Great to have you here.
Thank